Heartburn in pregnancy is a common complication that does not mean it is in your heart. Your heart is not burning. It is just between your esophagus and your stomach. So what causes heartburn in pregnancy is the fact that the acid in your stomach begins to leak out through the door that separates the esophagus from the stomach. So if that door becomes weak, stomach content that has acid will begin to seep through and then begin to corrode the lower part of your throat. That will now make it look like it is a heartburn or giving that burning sensation. What causes this heartburn? It is because of the pregnancy hormones. So these hormones in pregnancy, they have a way of making that door to be weak, and then things can easily flow from the stomach back to the throat and causing that burning sensation. Another cause of heartburn in pregnancy is the fact that the womb begins to grow and puts pressure on the stomach. So that pressure on the stomach will push content in the stomach out into the esophagus, still giving the burning sensation. Heartburn in pregnancy usually starts in the second and third trimester when the baby begins to grow bigger, but some women start experiencing heartburn from their first trimester all through. There are natural remedies and lifestyle modifications to help you ease the discomfort of heartburn in pregnancy. The first is that avoid your trigger foods. If you know any food that tips you into heartburn, don't eat them. If you are used to wearing tight-fitted clothing, now you have to wear loose clothing because it will put pressure on your stomach, forcing acid and food back into the throat, causing the burning sensation. Another thing you should stop doing is going to bed immediately after eating. So don't lie down immediately after eating. Eat at least 3 hours before bed. That's when you should stop eating. Don't sleep flat again on the bed. Use about 2 or 3 pillows to push your head up so that gravity would help you to keep those food inside the stomach instead of flowing back upwards. There are foods that you should not be taking. Foods that are spicy, peppery, oily. Chocolates, citrus fruits, caffeine. These foods have been proven and shown to cause or increase the likelihood of having a heartburn in pregnancy. Another thing you can do to ease the symptoms of heartburn in pregnancy is by taking milk. If after these lifestyle modifications and you still keep feeling those burning sensations, then you should talk to your doctor. Don't self-medicate because there are different antacids out there. If you find yourself coughing or having asthma-like symptoms, or you have bloody stool with this heartburn, do not stay at home looking. Rush to the hospital because these are some complications already arising because of this heartburn in pregnancy.